And I want to draw special attention to all the incredible people here at Thrive who work tirelessly to help those suffering from substance abuse disorder. As a result of your dedication to serve others, many of our friends, our neighbors, and loved ones have been able to heal and discover a sense of renewal and hope for the future. I also want to thank all the advocates, the family members, and the professionals who have joined us here today, especially Dr. Jeffrey Reynolds, who I've had the pleasure of working not just at the county, as a county legislator, but now as a state senator. You have dedicated over 25 years to this cause, and we are forever grateful to you and your passion and compassion and heart that you have for this. So thank you. The medical, social, and psychological toll from substance abuse disorder is enormous. And for that reason, the state legislature was determined to include funding for Recovery High School in this year's budget, as well as $600,000 for the Family and Children Association to provide new services that will give more individuals access to treatment. Additionally, the 2019-2020 budget included critical reform measures, such as increasing access to 28-day inpatient and outpatient treatment, which allows individuals to get attention, medical attention, without waiting for authorization from their insurances, and removing the cost of barriers from those undergoing outpatient substance abuse treatment. Another important reform included in this year's budget requires emergency rooms to have policies and procedures in place to provide medically assisted treatment to overdose patients prior to their release, which will work to provide a comprehensive and safe plan for those individuals upon discharge. While I am so proud of what we have accomplished this session, I recognize that there's still much work to be done when it comes to adequately funding the necessary programs needed to combat the opioid epidemic that we are seeing here on Long Island. And I will tell you that this man sitting to the right of me, when we were in budget negotiations, he used social media and tagged every single one of us to my left to make sure that we knew that there was funding missing in the budget. And it takes advocates such as yourselves to make sure that we, the policymakers, know what you need. You have such a great champion here because he did that. And as soon as we all were tagged and we saw the tag on Facebook, we were like, whoa, whoa. And every single one of us spoke to somebody behind those closed doors and said, you need to put this back in. So we want to thank you, Jeff, for making sure that we also knew. It's a big process. The budget's a huge endeavor to overcome, and we needed your help. And thank you, because without you, we wouldn't be here today announcing the great work that we did behind closed doors. So thank you all. So now I will present my colleague and friend, Senator Anna Kaplan, to speak next.
Thank you, Monica. Good morning, everybody.
Good morning.
Thank you for coming this morning. I want to thank the advocates, and of course, Dr. Reynolds. My relationship is not really as long as Senator Martinez's is, but I'm looking forward to working with you and really getting results. So we all know Long Island is in crisis. Addiction has touched every family, every school, and every community. We've lost far too many innocent young souls to this disease. And we've watched our friends and family, desperate to get help, have been failed time and again by a system that doesn't understand their struggle and is only designed for punishment, not support. We stand here today to say that we're done with half measures and empty gestures. That we're ready to fight the disease of addiction by doing everything we can to help people get into long-term recovery. I'm proud to say that we just passed the state budget that will do more to fight addiction and support recovery than any budget in the history of this state. We funded a brand new recovery center for Nassau County that I'm proud to say will be opening in my district very soon. We funded expanded services across Long Island that would help get survivors of overdose into treatment centers instead of going back out on the street. We funded a recovery high school to support young people in recovery who are making a decision to choose life and an education free of influences of substances. And we broke down barriers to critical care by expanding access to 28-day rehabilitation programs and reducing of the pocket expenses to access outpatient services. We've done that with hand in hand with our governor and also our Senate leader, Andrea Stewart-Cousin. I want to thank them for when this was not in the budget and we brought it to their attention, they realized the importance of this and put it back in the budget. These are critical steps to help alleviate this crisis, but I want you to know this is not where the fight ends. My colleagues and I are going to continue to relentlessly pursue legislation to ensure that people can get the help they need so that no one needs to lose another child to this terrible disease. Thank you.
Thank you. And now I would like to welcome Senator Kaminsky, but before I do that, we have Senator Kaminsky, Senator Thomas, Senator Gaughran, and I also want to acknowledge a friend and former colleague of the Suffolk County Legislature whom I miss terribly, and that's Legislator Sarah Anker. Has been a tireless advocate as well by putting together finally the permanent heroin and opioid task force advisory board. But thank you. Senator Kaminsky?
There is no more searing and difficult experience as a politician or an elected official, although it certainly doesn't compare to the sorrow that families are going through when we meet with families in Albany or in our districts who have lost loved ones to this disease. When a parent looks at you and tells you a story about finding their child, there is nothing that is more touching and gives you a sense of mission of what must be done. You cannot leave a conversation if you are a feeling human being without knowing the mission that you have to fight as hard as you can to make sure another parent does not experience what that parent is going through. And that's the mission that we all took seriously during this budget season in Albany. All of us in the Long Island delegation worked together, and when we work together, which we've learned to do quite well, we get things done. And so when it came to expanding treatment against insurance companies without pre-authorization, when it came to funding, and when it came to making sure that our statewide colleagues understand what this means on Long Island, we were unified, we were persistent, and we would not take no for an answer. And that's what is necessary. When I talk to experts in this field, I have a sense right now that we can turn a corner. But it's going to take a lot to continue down that path. And in a lot of places that's not true, but here on Long Island we have an opportunity. And so it's up to us elected officials to give the providers the support they need to get the job done, and we will continue to do our best to do that. And we hope we have many more days like this where we could celebrate what's possible. Thank you.
And now we have Senator Thomas.
Thank you, Monica. Thank you to the rest of my colleagues. Just as you heard from my colleagues, we fought hard in this budget. We brought back a lot to the island, and this was one of them, funding for this crisis here. The opioid crisis affects millions of people from all walks of life. Addiction touches the lives of so many of our family and friends. This budget secures funding that will tackle this brutal epidemic head on, supporting life-saving programs that will help those battling addiction. One way the state is taking a proactive stance is with increased availability of a safe alternative drug used to help with recovery from opioid abuse. Governor Cuomo is ordering all hospitals statewide to establish protocols for the emergency departments to incorporate that drug for overdose cases. Legislation will make sure those impacted by addiction get the care they need. Thanks to my colleagues in the Senate and Albany for making these programs a priority in the budget. Nothing is more important to me than the health and welfare of our residents. Thank you.
And Senator Jim Gaughran.
Thank you very much, and I do want to thank Senator Martinez for her leadership on this very important issue. You know, we now have 6 Democrats elected to represent Long Island in the State Senate. And you know, the importance of that is shown in this issue, because gone is the time where we're going to study the opioid crisis, we're going to look at this, we're going to consider this. We made it very clear. We know what you need. You need money. You need to put the money in the hand of the providers, the people in the field, including volunteers that can step in and help these young people and people of all ages who are facing this opioid crisis. That 28 days we know is critical. A recovery high school is going to save lives. But we are just so grateful for the work that you do every single day in the field. And we in Albany are just going to continue to fight to try to provide the resources that you need. Thank you so much.
Thank you, and I did want to give my colleague at the Suffolk County Legislature the opportunity to say a couple of words. As I said, she's been a very active member in the county legislature fighting for this. And with her efforts on this advisory board, we were able to get a spectrometer who will now, assist our medical examiner, making sure to make sure what is in the drugs that they're finding alongside with our police department, our detectives. So without further ado, Senator, I just wrote it. Before we take it out, I'm sorry. But Legislator Sarah Anker.
Unfortunately, I can't talk very loudly, but I am a very strong voice for the opioid addiction issue. And this morning I went to Suffolk County's Bar Association. We were invited there for breakfast. And I started to hear more and more about drug court. And Jim had mentioned the educational part of understanding the kids. A lot of young adults, we can't just incarcerate them. We have to help them. Addiction is a mental health issue. It's a co-occurring disease. You see everyone's yes. And we all need to be part of the solution to help with the problem. And it's amazing to see so many of my senators, and even more so many advocates that are a loud voice that will help us get to where we need to go to protect our families and especially our kids. You know, Suffolk County has sued the opioid pharmacy production folks, this Sackler's, right? Sackler family. And we're hoping to see, maybe we'll get some funds that we can put back into this addiction issue. But again, everyone here, everyone listening, we are going to make strides to succeed and protect everyone around us. So again, thank you so much, Monica, for everything that you do. And I look forward to continuing partnering with every level of government, schools, villages, everyone, to resolve this issue. We can't give up. Thank you.
Thank you, Sarah. And now I would like to present to you Dr. Jeffrey Reynolds, who will also then present the advocates who are here with him. And again, here is a man that I'm going to present to you who has worked for 25 years plus, making sure that families have the right place and resources and people to help them. This is not something that can be done alone. This is not an epidemic that can be solved in one day. We've been fighting this for decades, and it's getting worse and worse, but we're making steps in the right direction. And we would not be here today in this beautiful building if it weren't for Dr. Jeffrey Reynolds.
So, thank you seems really insufficient. You guys promised on the campaign trail that you would do right by Long Island, that you'd deliver, that you'd respond to our most public problems that are impacting the community, and you delivered on that. And so from all of us, and for those not in this room, thank you so much for your efforts. We really appreciate it. Typically, when we've done these kind of press conferences and gatherings, we talk a lot about the overdose statistics, and over years, we've watched them climb and climb and climb and climb, and more families are sitting in these chairs. Well, there are lots of empty chairs around the dinner table at home, and we know that last year we finally began to turn a corner. We watched the overdose fatalities begin to drop. And while we are all often very, very cautious about celebrating those victories, because we know that in some cases, as soon as there's a glimmer of hope, it means that everyone packs up and goes home. And we know that we can't stop until that number is zero. It's not zero. But we also know that one of the reasons that we got to this place was that the prevention, treatment, and recovery continuum had significant holes for people who are struggling with the disease. We haven't filled all those holes yet, but we're well on our way to being able to do that. We're sitting in a place that was described 2 years ago, and we opened it as a home for recovery, not as a building with chairs and programs, but as a home for recovery that Long Island sorely lacked. We've been through multiple drug crises here on Long Island. Addiction is nothing new, yet it was only in 2017 that we actually got a recovery center here on Long Island. But from that, we saw folks come through the door having left treatment, and they walked in and said, I finally feel like I belong. I found a place where I can socialize without the use of drugs and alcohol. I found a place where I can write my resume and get back to work. I found a home and I found a community, and that's what helps keep people on the right path. The money restored into the budget this year will enable us to open Nassau County Thrive. We're looking at a date of May 15th. And as awesome as that is, so some of my staff are making faces, because like, how are we going to May 15th? Are you kidding me? Did you have to say that? Lisa. So one of the key issues really is, Nassau County Thrive is awesome. We still need one in Southampton. We still need one in Freeport. We still need one on the North Shore. We still need to make sure that there's a recovery community in every single community across Long Island, because guess what? Addiction lives in every community across Long Island. So we'll be back next year on social media and in person talking about the needs. But we really are looking to build on the successes. On the issue of Recovery High School, it's something that our governor, who's been a friend to our community, promised in Farmingdale 2 years ago. We know that it's our point of view that every high school on Long Island ought to be a recovery school free of drugs and alcohol, where kids can return from treatment and recover. But we know that in a lot of cases, schools are anything but sober. And so there ought to be a place where young people go in order to put their recovery first, and then social and emotional learning second, and then academics is but a distant third. And then the Sherpa program, which was also restored in the budget as a program, and I think Jen is probably going to say a few words about that. One of the things that we came to understand is that there were folks who were brought into emergency rooms 24/7, having suffered overdoses, and those families follow them into the emergency rooms, believing that this will be the breakthrough moment where our loved ones get help, and very often those folks die of an overdose after being released within 15 or 20 minutes. We managed to turn that around by taking folks with lived experience, those who are closest to the problems, putting them in those emergency rooms and talking to patients in a way that perhaps nurses and doctors can't, in a way that perhaps social workers don't have time to do, and the results have been nothing short of phenomenal. In every single one of these programs, we made sure, and they would not have been possible without a partnership. And so when we think about Thrive, this all came to be because organizations came together to make sure that we had the best possible continuum of care. And so I want to acknowledge Lyra Rich Buckman is in the back. And from FIST, Families and Supported Treatment. And both Adam and Lauren are here from LICAT. Sherpa 2 is not something that we've done on our own. It's in partnership with Catholic Health Services, but also with a lot of support from a parallel program run by Linda Ventura from Thomas's Hope Foundation. And so we've come a long way. We certainly have miles to go before we sleep. I won't talk a lot about the insurance pieces in the budget, but they are excruciatingly important. One of the things that we've worked to do over the years is to reduce those barriers to care and to extend the continuum of care. But aside from the partners that we have in the field, one of the things we know is that we've gotten as far as we have today because of those folks with lived experience. Because there were families like Linda who weren't shy about going up to Albany, sometimes bringing their loved one's ashes in a Tupperware and saying this is what failing an outpatient treatment looks like. From people with lived experience who took the risk and said, I'm a person in long-term recovery. It's finally becoming okay to do that, but for a long time it wasn't. And there were people early on that took risks, that paved the way, that made sure that we'd see a drop in those overdose numbers and made sure that we'd get to where we are today. I want to introduce you to Jennifer Brock, who's going to talk a little bit about her personal experiences.
Good morning, ladies and gentlemen. I'm a certified recovery peer advocate here at Thrive and also with the Sherpa program in the emergency department under FCA. But more importantly, I'm a person in long-term recovery. And what that means is that I am a person who struggled for an extraordinarily long time with substance use disorder, and to the public more commonly known as addiction. What that means is that I went through so many things, feeling all alone, feeling lost, having no idea, not having heard the word recovery for my entire life. I'm 43 years old, and at 41, I finally Googled treatment. Thank God for Google, because I figured out what it was, and I started to reach out for help. The beauty about what this space represents is that we don't have to search and seek out. It's right here. Peer-to-peer services, which is what Thrive stands for, which means I have been through it. I have been through the depths of it. I have done everything that the treatment centers talk about, the jails, the institutions, and even an overdose twice. So the piece where Sherpa comes in the emergency department, where rather than someone in a lab coat who we're going to perceive has no idea what we've been through, and there's no relating there. Rather than that, someone like myself who's in long-term recovery and has gotten the resources and services that are so important to getting, maintaining, and sustaining recovery comes bedside. One of the Sherpa program staff members will come right to your bedside and say, what is it that you would like to do to maintain a recovery program? And then, because of buildings like this and because of the staff here, we know what somebody who is either in active addiction or in early recovery or some sort of sustained recovery needs. And as advocates, we find those resources so that we can kick down those barriers for the people of our community that stop us from being able to obtain, maintain, and sustain that recovery. Thrive Recovery Center is miraculous. The thing that comes across my mind when I think about Thrive, and thank you, Jeff, so much for this opportunity to speak and this space, because when I was in early recovery, I walked into Thrive, I was introduced to Thrive and walked into this space, and for the very first time in over 4 decades, I knew that people understood. Not only did they understand, this space represents the term, we can do together what we cannot do alone. That meant so much to me. When I walked in here, I had no idea what I was going to do because I had demolished my past. Demolished it. They started to put, and this is what we do now, put the planks to build that bridge from either active addiction or early recovery into independent living. And that's amazing. What we do here as advocates is ask you, what can we do to help you get to where you want to go? You tell us, and we start to build that bridge with the amazing amount of resources that we have been able to find, figure out how they work, and how we can provide them to you. Thrive Recovery Center is the most amazing space as well, in the sense of when you come in here, there is somebody always available that understands where you go as someone with substance use disorder, what happens, how you feel, what you've been through. They also understand how to help you get out. Healing and connection to other people is how we do it. And anyone who's out there listening to this message that is either in active addiction or in early recovery, seeking recovery or seeking to maintain that, because maintenance is everything, call us. We will help you. If you're a family member whose loved one is in the emergency department, ask for the Sherpa program. The relation that that individual will have when they see the light in our eyes, that we've been there and we found the way to get out. The way to get out is 100% from peer to peer relation. Thank you for allowing me to speak.
So, how many people, you're a rock star. How many people got a hug when they walked in here today? All right, so those kind of in the room or in this room a lot kind of know what I'm getting at. Just need a lot of introduction. The hugs say it all. If you guys haven't been recipients of hugs, you will be. There's a lot of cameras on, so we're watching. It gives me great joy and pleasure to introduce you to Claudia Frizzell.
Okay, so before you leave today, if I haven't hugged you, I'll be by the door. Hug me on the way out. So hi, I'm Claudia Frizzell, for those of you who don't know me. I'm a mom, sister, mother, daughter, friend, neighbor. I work at my local library. This May 2nd, it'll be 19 years since I buried my oldest son from an overdose. For me, luckily enough, believe it or not, luckily enough, I had Daytop Family Association. My son went to Daytop, so I had a support system in place. It's rare, and it was super rare 20 years ago. Thrive provides a home for all of us who feel left out, forgotten, judged, shamed. Thrive is what I always dreamed of having when I was shunned and shut out. And that is, it's all of the community. It's families in supported treatment. It's LICAD, it's Lyra, it's Family and Children's, it's Sherpa, it's people who are in recovery and their family members, and that's what we need. And it's legislators and senators and community members and the guy who pumps your gas, because you know what? We're all in this together. And it's all really important that we all work together and not, point fingers at who did what or who didn't do what, but open your hand, open your heart, open your arms and say, what can I do for you? How can I help you? I thank you so much for the hard work that you've done, but I have to admit, all due respect, we will be on you. We will be all over you. Don't let this gray hair and this short person fool you. Or the hugs. Or the hugs. Because I will hug you and say, yeah, I'm not letting go until you say yes. Truly, I am so grateful for all of you and so grateful to my friends out there, because 20 years ago, when I would stand up and tell people that I buried my oldest son, there were very few people who could understand, and unfortunately, right now, I can see a half a dozen moms here who are my friends, and I consider family now, who also understand. There are way too many of us angel moms out there. And although we have a very unique connection, and I'm grateful for their love and support, I wish I didn't have them, and we shouldn't have any more. So let's work together. And don't forget to hug me on the way out.
So before I hand it back to Monica, just one more time, thank you. If for those of you who follow the Senate delegation, and I know Senator Brooks couldn't be here, for those of you who follow the Long Island Six on social media, you should if you don't, by the way. It's a real good way to get their attention sometimes. But if you follow them on social media, you probably saw, quite frankly, them literally working 24 hours straight, 48 hours straight, 72 hours straight on an incredibly complex budget in which all sorts of things could happen. And so our dropping out of the budget was something that could have gone unnoticed, could have gone ignored. When these folks learned that this was going down, every single one of them jumped to our defense and made sure that this all happened. And so thank you so much to all of you. You guys weighed in on behalf of Long Island. And quite frankly, and I don't think it's overstating it, you help to save lives. And so when the hours get long and you show up in places and nobody's happy and nobody's thanking you up and down, know that we'll always push you to do more. But I hope you feel the gratitude here in this room, and it comes from all of our hearts. Thank you.
Thank you, Jeff, and you have the commitment of us six to continue working with you, with the advocates, the community, because it does save everyone. Floyd, I'm sorry for the loss of your son, and for those of you who have lost loved ones. This is something that has impacted all of us, directly, indirectly, and it's something that we cannot continue to experience. We're losing too many lives, too many young lives, and yes, we have Band-Aids sometimes, right? But we don't need Band-Aids. We need full recovery. And at the county, I also work with Jeff on the Sober Home Committee. And I would like you to know, Jeff, that I put legislation in because sober homes here on Long Island are not they're not even regulated.
Right.
Okay, they're not regulated by the state of New York. And this is something that we need to focus on because we have way too many sober homes out there that are not regulated, and instead of recovering, they're going back into addiction. We have landlords, we have managers that are not doing the right thing by those individuals, and they need to be held accountable.
Yeah.
My first thing also at the Senate was to make sure that we started focusing on these